my screen real quick here. Visual monitor always gets me. Okay. So just a few housekeeping. If you're not speaking, if you could please mute your mic. And if you have any questions, feel free to raise your hand or speak up or use the chat feature as well. And then we have a few announcements that we will go over after the presentation. So Pamela, I know we're kind of putting you on the spot here and you might not be in a presentation to have any updates to give, but I did see that you were on. So if there's anything that you are able to share about the vaccine in the New River Valley before we kick it over to Eric and hear his presentation, we would be grateful.
Good morning, everybody. Sorry that I don't have video, the component to this, a little bit limited bandwidth right now. But yes, good morning. I am with the New River Health District. I am the Population Health Community Coordinator. And I was just trying to send Dr. Bissell a note to see if she was going to be able to jump in. I haven't heard back yet. So the biggest thing right now with the COVID vaccine is our rollout for vaccinations. We've been doing this now since probably the last week in December, have vaccinated well over 15 or 16,000 people. Most of that has been through the health department, but in the last 2 weeks, we've been able to share. I'm not sure what that audio is coming in the background there.
Looks like somebody's unmuted.
Okay, sound like it was a weather update. That we all need those. Anyway, we've been working now with independent pharmacies to also get vaccinations out there. We have finished up almost completely phase 1A of the vaccine rollout, which was for our healthcare workers and the folks in long-term care facilities. And we rolled into 1B, which is essential workers and people age 75 and older. Then the governor expanded phase 1B to include people 65 and above, and then expanded again to include those in the age of 16 to 64 who had underlying health conditions. So by the time with the 3 expansions of phase 1B, we had more than 8,000 or 9,000 people registered to get vaccinated. And during that time period, that was when we had the COVID vaccine capacity cut back. So we went from getting between 5,000 and 6,000 doses a week down to getting 2,000 doses a week, which meant we drastically had to cut back our ability to vaccinate. With the increase now of production of the vaccines, we are starting to ramp back up. As a matter of fact, this week on Monday, even though it was a holiday, we did vaccinate, probably had about 500 or 600 people. And then Tuesday we were close to 1,100. And then yesterday, because we were anticipating today's weather, we canceled people's appointments for today and we took a lot of them in yesterday, and we did almost 1,600 people yesterday. So you can see we're able to adjust fairly quickly. We are using both the Pfizer vaccine, which is a 2-dose shot with 21 days in between the doses. And then we're also using Moderna, which is a 2-dose shot with 28 days. The one thing about those doses, although they say very specifically 21 days and 28 days, we do know that up to 6 weeks in between the doses, you still get a very effective boost in immunity. And the protection level for both Moderna and Pfizer is approximately 94 to 95% after you've had the second dose. And we're seeing that effectiveness being very much protective after about 2 to 3 weeks post the second dose. So there is a fair amount of understanding that there is protection. Now, everyone's been asking, why do I still have to wear a mask after that? Well, because that 5 or 6% that remains unprotected or maybe not completely protected is important. And there's still evidence that you may still even be able to transmit virus, even though you're not showing symptoms yourself. So masking and distancing are still going to go on. Now, yesterday, the governor came out and announced the opening of the central registration process. And it did not go off without a few glitches, which always does happen. They're merging databases from all across the state. And anybody who does IT work understands when you have those kind of large volumes of data, it takes a long time to get all the data transferred over there. So there's been a little bit of concern that when people have gone in to check and see if their pre-registration has remained intact, that maybe their names haven't shown up. New River Health District was the first health district to actually have its own call center and to have its own registration system. And we've held that near and dear and tight to our chest to make sure that everyone's data is safe. I can assure you that the data is safe, and we are continuing to maintain our own database as an ancillary backup to whatever the state is doing right now until all the glitches are worked out. So people can still be assured that we have maintained our data and that we are continuing to work to reach out to everybody to make sure that if you qualify in group 1A and 1B, that you have been contacted and appointments are being set. We are looking at moving further down the road that at some point, rather than having a one centralized vaccination clinic, we may be able to do how we do our flu pods, point of delivery. And that would be to do pop-up vaccination clinics throughout each area of our district. So maybe in Pulaski, in Giles, in Radford, and in Floyd, rather than just in Montgomery County right now. But anybody who's gone through our vaccination system, I hope you can attest to the fact that it's a pretty well-oiled machine and we're pretty efficient. Even yesterday in the peak of getting through those 1,500 people, no one had to wait longer than 45 minutes. And that was from start till finish. And that includes a 15-minute wait time at the end of the vaccine where you have to wait to make sure you aren't having any type of reactions or side effects. I'll just give you the information for the how to contact to get into the pre-registration system for the state, and that is vaccinate.virginia.gov. And I have to go and look. There is a 1-800 number that actually just opened up yesterday, and that's also to get to talk to that live person rather than just go and doing everything electronically, which is important for, first of all, anybody that doesn't have a computer or access or has limited access, or maybe just is not familiar enough or comfortable enough using a computer. And certainly we have a lot of those folks we're working with that is potentially a real problem. So we think about trying to make sure that we can reach out to anybody in an area that has limited connectivity, and they can use the phone system, and they can also try to do it on their own. We're also encouraging everybody, regardless of whatever system you're using, to ensure that you're helping other people who may need assistance. So if you're representing an agency here on this talk, it would be really great to make sure that you're reaching out to those folks that you know may have some problems getting registered. And that's been very successful across the state with people being able to do that. So that telephone number, I'm going to give you the real numbers rather than the words that they used. It's 1-877-829-4662. And that's a call center that operates from 8 to 8, and that's 7 days a week. And they're there.
4682. Sorry to interrupt you, Pamela.
4682. Sorry.
Yeah.
So that number is available, and they're there 8 to 8 and 7 days a week. So feel free to pass that one on. And then again, it's vaccinate.virginia.gov, and you'll be able to walk through the pre-registration. And the good thing about that pre-registration is that there is something called, you can check your registration there, and you'll be able to see, it's called checking the list, and you can make sure that you actually did get registered. So again, as they continue to merge those databases, your name should be showing up on the check the list. It may not be until Monday or Tuesday where that occurs. The site's only been live for 48 hours now. The phone number's only been live for about 36 hours. So there may be, still some delays and some glitches, and the governor assured everybody though that it's going to work out. So other than that, I'll just stop there. I think that gets us up to date. If anybody has any questions, please feel free to ask them.
Thank you. I really appreciate the update. Does anybody have any questions? And Eric put that information in the chat box. So thank you, Eric.
And I will just say, watch the nrvroadtowellness.com website, and that is available, and that was put together through our task force, the New River Valley Task Force for COVID in the health department, and that's up and running, and that has regular updates, including local access numbers, and you can always call the health department. We still have our COVID hotline, which now has been up and running. Gosh, it doesn't seem like it's been more than a year, but it's been a year since we put that up just to help people out. And that number is 540-267-8240. And then the COVID vaccination line, we're still available to help with that. And that number is 540-838-8222. And that's very specifically for vaccination questions. We're here to help everybody, and we'll refer you to the proper people if you need assistance. So the vaccination hotline is 540-838-8222. The COVID call center through the health department, 540-267-8240. And if that doesn't fail, if that fails you, you always can call the health department at 585-3300.
I did register with the old system, and I got an email letting me know I was transferred over to the new system. So it seems like everything has converted well.
That's great, Ashley, because there was a lag, and we got a lot of panicked calls yesterday, and I was answering Facebook messages till about 2 o'clock this morning. So yeah, that's good to hear that it is moving through. And I'm hoping that everyone will be reassured. I think everyone thought, well, I signed up for one and now I have to go to the back of the line. No, you don't. You're in the system. And then it reverts back to the localities actually to make sure that people do get vaccinated. So it's kind of a double layer, but again, we are still holding everybody's position, and they're being vetted appropriately by where you are in the tiered phase system.
Yeah, I thought it was worded really well, letting you know you're still in the system, you haven't lost your spot, rest assured, all is well. So I thought it was a pretty, on my end at least, it seemed quite seamless. Does anyone have any questions? Okay. All right. Well, Eric, we can kick it over to you now.
Wow. Dr. Ray was able to do that so spontaneous, off the cuff. I now feel like I'm not prepared for this presentation. Good morning, everybody. I'm Eric Chapman. I'm an attorney and partner at Cowan Perry in Blacksburg, Virginia. Cowan Perry is a law firm with offices in Roanoke and Blacksburg, and we are a boutique firm providing outside general counsel to businesses exclusively. That's really what we do. So, I've been asked to come on here and talk a little bit about the vaccination and how that's affecting workplaces and what employers should know and what employees should know about it. For those of you who missed the pre-session chat, I'm broadcasting with you live and direct from my garage. It is cold, hence my flannel. I checked my GQ. It did not identify whether Argyle or what type of suit was appropriate for cold basement, so I'm going with the flannel. I lost the tie because it's too early for that nonsense, and I've been ice skating with my dog. So let's talk about vaccinations in the workplace. Everybody's got ideas, everyone's terrified, the guidance is all over the place. Not really. So the first question I normally get when this topic comes up is usually from an employer calling me is, hey, Eric, can I require that my employees get vaccinated? Because that's, where the employer starts is, do we have to mandate something, and what's the takeaway from that? So the answer to that is yes, generally speaking. So federal law essentially covers this. The Equal Employment Opportunity Commission has given guidance that certainly suggests that an employer may make the determination that a vaccine is mandatory for its employees, asterisk, with some exceptions we'll carve out in a second, and that's going to be okay. So we have a public health emergency. You have a duty to keep your employees healthy and safe if you can in the workplace. You have maybe not a duty, but you certainly have an incentive to keep your customers, your volunteers, your residents, your patients, if you're a medical facility, safe. So there is, a driving impetus or policy reason behind a vaccine or having your employees vaccinated. I think where that kind of skips a little bit, though, is simply because you could require the COVID-19 vaccine in the workplace. It doesn't mean that you have to. So I've seen no guidance, and I'm not aware of any legal precedent. I've looked into this for quite some time and talked to people much smarter than I am, that says that an employer who does not require their employees to be vaccinated is going to be liable for that failure. Assuming that employer is also taking other proper steps and protocols to maintain health and safety in the workplace, such as adhering to the Virginia permanent standards. You may recall me from other great broadcast episodes, such as webinars on the Virginia temporary emergency standards promulgated last July to reduce the risk of exposure and spread of COVID in the workplace. Man, that's a mouthful. We called them the TES. Well, the administration here in Virginia made those permanent as of the end of January, so that we now have the Virginia permanent anti-COVID standards, which I'm just calling the Virginia standards because it's shorter. So as long as an employer is abiding by those regulations, that includes your social distancing aspects, your requirements of face coverings in the workplace, your assessment of whether you need additional enhanced protocol or personal protective equipment if you're in a higher risk occupation or job that's generating aerosol or particles, such as, for example, a dentist office or a medical treatment facility working with COVID infected employees. So long as you're abiding by those, you're likely meeting, the OSHA is the federal level, and OSHA, that's OSHA with a V, Office of Safety and Health Administration, you're likely meeting their requirements for workplace safety. So again, requirement is something you can do. It's probably not required, though, to shield you from liability. The more relevant questions I'm getting are, well, I want people to be vaccinated. We want everybody to be safe, but it seems like there's a lot of uncertainty and a lot of pushback. Sorry, I should back up. The footnote on that requirement aspect is, it's not clear at this moment whether you can require people to get the vaccine because it is still under FDA emergency use authorization. And that's important for two reasons. One, I could go out tomorrow and say everyone in the firm must be vaccinated immediately. But that's not realistic. They can't access it. It's on a scheduled rollout, as Dr. Ray just alluded to. So that mandate would have no effect. And there is some legal question whether an emergency use vaccine can be mandated as opposed to a generally approved by the FDA vaccine. I don't really put a lot of weight on that point, because I think the better balance point on average is for employers to encourage vaccination, which is what most of my clients have been doing. I've had a few come in and say, we're going to require it, bar none. And I've said, well, why don't you take your temperature first? Why don't you maybe do an anonymous survey, ask some of your managers that you trust or some rank and file employees how they feel about it, because there's a lot of uncertainty about a vaccine. And I do think that some of the uncertainty about, could it have medical side effects? I think you have to concede, absolutely, it could. I would say the side effects of COVID, on balance, to the public health and to your health may be worse. I tend to find death worse than a fever. And the protection rate's extremely high. But to be frank, there's a lot of, I'm not going to call it misinformation. It's bad information. It's misdirection out there in the world. I really don't think that Bill Gates is going to use the vaccine to control my mind. If he wanted to do that, he would just drug coffee. That would be a much more, caffeine would be a much more effective mind control medium than a very controversial vaccine. I mean, heck, put it in the beer, we're all done, or at least most of us. So there's a lot of bad information. And because of that, I think there are a lot of people who are rightfully or wrongfully hesitant about the vaccine. I expect some of that to die down as more people are vaccinated, as more information comes out, as there are less sensationalistic news reports about the 1 or 2 people who had an adverse reaction worldwide out of the potentially millions who have been vaccinated. So I'm telling a lot of employers, let's take this slowly. I think that social distancing, I think that COVID-19 protocols, including staggered work shifts, quarantine, telecommute, all of the things that we're doing to ensure our safety the best we can through this time, these things are going to be with us through 2021. There, I said it. People hate it when I say that because I was saying last year that this is going to be a 2 to 3 year process, but I think that's the truth of it. So if we recognize that in the context of the vaccine and the rollout, the phased rollout, the final approval of the vaccine, and the law that's going to develop around that, we can take a deep breath and go a little bit slower. So let's go back to, I'm an employer. I took an anonymous survey. My personnel workforce is a bit mixed. I'm not in a industry or system where there's a overriding safety concern. Requirement for employees, I think probably is going to be more the question if you are in senior healthcare or assisted living, if you're in direct healthcare at a hospital, if you're in the dental fields or the mortuary fields. But to be frank with you, those industries, the healthcare industry, have had these requirements for years anyway. But most hospitals either strongly encourage or have a requirement that certain personnel get the flu vaccination. They have very robust vaccination policies. It's not the manufacturer down the road or the accounting firm across town. So that is going to be where the impetus for requiring the vaccination hits. But let's say you're a run-of-the-mill law firm or nonprofit. Well, I think you have to look at a few things to determine whether you want to toe that line of required vaccination versus encouraging. And I think most of us will fall on the encouragement side of things. But you want to look at what's the population you work with? What are the demographics? Are there any characteristics there that put them at a heightened risk or put your employees at a heightened risk, frankly, for COVID that isn't generally dispersed through the population? If there is, you probably want to talk to an attorney. We're happy to talk to you or your friendly neighborhood employment law attorney, wherever you're at, offline, because you may want to do an individualistic assessment of your vaccine policy. If there isn't, and you're more general run-of-the-mill business, your retail, your frontline, let's look at encouragement policies. I like incentivization of vaccination for a couple of reasons. I think it recognizes that we're doing something good for the public health, and also it doesn't penalize the employee for getting a vaccine. So scheduling vaccine appointments and providing paid time off for the employee to go get it. I have some employers giving a little monetary bump. Maybe you get $100, $200, $500 if you get the vaccine once you complete the both doses, assuming you can. I've seen some ones where people have said, look, I'm giving the afternoon they get the vaccine off and the next day off for PTO because some people are experiencing fairly severe side effects. And I've had multiple friends and multiple clients now who have received the vaccine and been pretty much unable to work the next day, high fever, achy. They've bounced back in a day or two. So that's a good potential incentivization. Those are more of the programs we're seeing. The best way, I think, to incentivize vaccinations in the workforce is education. Education about its effects, education about its efficacy, how it's going to help protect you and your family and your coworkers and our customers. And those things are going to come with time. We have to have that good information. We have to get it out. It has to come from credible sources. I think employers, I know we're maligned a lot, but we're often a credible source for the employees who work for us. They frequently trust us, or I hope they do. I think nonprofit organizations oftentimes can be another purveyor of credibility with regard to this information. So consider whether the groups you service might be conducive to receiving that information from you. Now, okay, we've got our employer, we're encouraging vaccination. Great. Where do we have problems? Well, we're going to have employees probably who don't want to get the vaccine for a multitude of reasons. There are really two primary reasons that we need to focus on, because those are going to be the ones that we have to raise our legal red flag about and probably go seek advice. And those two reasons are going to be a medical condition, which may fall under the Americans with Disabilities Act, or a sincerely held religious belief that says, my beliefs don't permit me to be vaccinated. I'm going to do these in reverse order because I'm not here to argue science. I'm not here to argue politics, and I'm certainly not here to argue religion. I'm wholly unqualified for that. But the religious exemption is where I want to start in this issue because, this gets trotted out a bit. To my knowledge, there is no major religious belief system in the world that has a direct principle of anti-vaccination. Whether you're talking about Christianity, Islam, Judaism, Buddhism, Jainism, we could go on and on, Rastafarianism. The one exceptions to that I'm aware of, and it's not even an exception, is there are some denominations of Christianity that prioritize faith-based healing. The most general description group I could tell you are Christian Scientists. And even within that umbrella, they don't have a direct anti-vaccination policy. They have varying interpretations. So you may have a employee who comes and says, I have a religious objection to receiving this vaccination. I want an exemption. And my advice to you is going to be tread lightly. They may have a sincerely held religious belief, and the EEO, federal law, Title VII to be exact, is going to recognize that is an area where you don't get to question the employee. You don't get to question the employee's sincerely held religious belief, i.e. I can't pull out a copy of the King James Bible or the Quran and start citing chapter and verse and arguing with you about whether you got it right or not. That's not our purview. What you can do, though, is you can assess objective factors. And what do I mean by that? And ask more questions if you have them. Well, for those of you who know me, personally, I'm just gonna use this as an example. I don't think there's any issue with the religion, but I'm not Orthodox Jewish. And if I were to come in tomorrow and tell my employer I don't want to get the vaccine because I'm Orthodox Jewish, absent, a late night conversion or early morning conversion, you'd be within your bounds to be like, okay, I understand that. I just wasn't aware you were an Orthodox Jew, and it's okay. You didn't have to tell me, but when did you convert? Okay, do you attend the local congregation or synagogue here? I mean, if you have questions like that, you're allowed to kind of ask around them or raise those issues. But I would strongly suggest you do that only after consulting with an attorney. So that's the religious exemption. I haven't seen one come up yet. I'll take that back. I've had one or two employees for clients say, I'm particular belief, I'm not gonna have the vaccine. And in both those cases, we were like, okay, because we kind of knew it was consistent with their their actions, and kind of we knew who they were. So it was like, well, that's fine. We're going to work around with you. And how we do that, we'll get to that in a second. The second one is a little bit trickier because it's gotten thrown around a lot during this pandemic. And that is a medical condition that's going to make you unable to get the vaccination that may fall under the Americans with Disabilities Act. This one is interesting because I think we're going to have a decent bit of ADA exemptions. And I think the vast majority of them are going to be valid. The difference, though, and you may have seen some of this in some of the, I call it bad information that was floating around Facebook, that you didn't have to wear a mask if you told the business that you had an ADA exemption. That was not true, but it was kind of true. You didn't have to wear a mask, and we could stop you at the door and say, okay, well, we'll find some other way to serve you. We don't have to release you from our rules simply because you have an ADA exemption. But the part that was always tacked onto those memes that really bothered me was, excuse me, the follow-up that said, and you can't ask me about it because it's HIPAA. That's not accurate. It's not true. It's not even applicable. And it's not true in the workplace either. So the Americans with Disabilities Act covers qualified individuals, bunch of legal words, with a disability that makes them unable to perform, well, they have to be able to perform the essential functions of their job with or without a reasonable accommodation. And in the ADA world, an exemption will fall under a reasonable accommodation kind of structure. But because we are, we have this thing we require or we're asking people to do, and we think they need it in order to do their job well. And they're saying, well, I don't want to do that, or I can't do that. Literally, I can't do that because of medical reason. Well, under the ADA, that triggers a process called the interactive process. And luckily, that's a legal term that isn't terribly opaque. It's exactly what it sounds like. It's interactive. And so what does an employer get to do in the interactive process? It's one of the few times the law's kind of on your side for this. We get to ask questions. Okay, I understand you say a medical condition, you can't get vaccinated. Gotcha. Can you provide me some doctor's information or doctor's verification? Just so I kind of know what that is. I need to figure out kind of what the lay of the land is, because I'm about to start making suggestions about how you continue to work here. That's the reasonable accommodation part of it. And I need to know what I'm working with, so I don't make dumb suggestions. So you get this back and forth. And if someone starts to stonewall you saying, I don't have to give you that information. I'm not giving you a doctor's note. I'm not telling you what it is. That's HIPAA protected, PHI. That's where my red flags start to go off, because there may not be a legitimate underlying medical condition that prevents this person from being vaccinated. The EEOC has came out very clearly and said that your personal belief about the benefit or lack thereof of vaccinations, or your personal belief about the medical information on vaccinations, are they going to be mind wash control tools for Bill Gates or not? Or are they not effective enough? Or is COVID, no more dangerous than the flu? Are not exemption grounds. So you got to have the religious belief or an actual physical diagnosable medical condition that prevents you from being vaccinated. So let's just remember those red flags and move on to the next. We have a sincere employee who has a legitimate medical condition. And I think this is going to happen. I've already got some, but it's going to happen quite a bit. What do we do then? Well, we're going to try and keep this employee employed. We're going to work through the interactive process with the employee and the employer to find a reasonable accommodation if one exists. And this is, I've got a few crib sheet notes here. I'll kind of skim them for you and talk about it. The framework you're in here is the Americans with Disabilities Act. And the way you get there is a qualification standard under the ADA that an employer can have a requirement that an individual cannot pose a direct threat to the health and safety of individuals in the workplace. So that's really where we're falling under this analysis. Is it our assessment that an unvaccinated individual will pose a direct threat to others, whether that's customers, patients, coworkers, whatever, in the workplace? And that's where we get into this. Okay, if we have that, and I think because of the nature of COVID-19 and the public health emergency, you meet that standard pretty readily in most cases. So if you have that, and then you have an employee who can't meet that vaccination requirement because of an underlying medical condition, we need to conduct an assessment, and we need to look at some factors. Well, how long is this risk? Well, it probably at least last through the public health emergency, or at least until we get herd immunity. So there's a fairly long duration. What's the nature and severity of potential harm? Well, death is a pretty big potential harm, so that's pretty severe. But there's going to be some questions there about, is it just to other coworkers because we're at a manufacturing facility, or is this someone who's in food service and might be interacting with a lot of people, and that sort of thing. And I think as time goes on, our nature and severity of potential harm will reduce as there's a higher vaccination rate in the community. You look at the likelihood the potential harm will occur. So that's, again, kind of a probability determination. And you look at the imminence of potential harm. And again, I think, the immediacy, how soon is it going to happen? I think that one is going to be an inverse relation as we get more vaccination. So But if we go through all this and we conclude at the moment that the individual who can't be vaccinated is going to be a direct threat at the work site, we can't just simply kick them out. We can't just simply fire them. But we need to look to see if there's a reasonable accommodation that can allow them to continue to work. And here's where I think a lot of employers are going to miss the boat, frankly. Let's think about reasonable accommodations that allow people to work. Well, let's flip the script. What about the employees who have previously come to us and said, I can't be in the workplace because I'm a high-risk individual with a medical condition? Okay, what did we do there? We did isolated areas. Maybe we moved them to a portion of the facility where they could be isolated, have separate entrance, and be moved off. But more than likely not, we let them telecommute, or perform their functions. Maybe we changed their shifts so they were coming in and doing non-essential work in the evening that had to be on site. Maybe there were staggered shifts. There's a lot of things we've already done, and those were all reasonable accommodations for those employees. So I think that we're going to end up in that same bucket of finding reasonable accommodations for individuals who can't be vaccinated due to an underlying medical condition to try and work through until we can reduce the imminent and severity of the threat in the workplace to a manageable level. And I think fairly, a lot of people are going to say we've already done that to some degree. We had the Virginia permanent standards. See, that's why I mentioned them earlier. I was burying the lead, and we got our social distancing. We have our mask. We have our protocols that are supposed to keep us safe in the workplace. So a fair point is going to be, yeah, I can't get vaccinated, but we're doing all these other things to keep us safe in the workplace. Isn't that enough? And the answer to that is going to be maybe. This is really going to be one where you want to bite the bullet, maybe find a pro bono or call me. You want to pick up the phone and try and do an individualized assessment, because the answer is not going to be the same for every employer, and it won't be the same across the board. But we're going to need to look at those solutions for keeping those employees employed. The one time that you get to terminate the employee at the end of all this, and I know no one here is looking to fire somebody, but that's if you cannot come up with a reasonable accommodation that is workable, that doesn't impose an undue hardship. And they really define that as basically it's financially crippling to the company. It's so rare that I can't come up with an example off the top of my head that would fit this scenario, or if it's just functionally impossible. For example, a waiter who for whatever reason can't be on the floor at a food service establishment, can't come into work at all, but maybe there's an underlying medical condition related to COVID. There's not a workaround for that. There's not a workaround for remote waiting, to my knowledge. If there is, I'll take that job. I like being a waiter. So maybe that's one. But even then, we're going to have to exhaust the other relief that the laws provide employees. The ADA, Americans with Disabilities Act, says in certain circumstances, a short leave of absence may be a reasonable accommodation. So maybe we're just waiting until we get enough vaccination to bring this employee back. If they've worked with you long enough and you're covered and you're a big enough employer, the Family Medical Leave Act is going to be the next thing you turn to. That's job protection. Granted, it's unpaid federal leave, but it is job protected federal leave for up to 12 weeks. So if they qualify under that, we're going to put them under that because we can't have them in the workplace. So those are the exciting things that I see coming down the pipeline when we talk about vaccinations in the workplace. I'm happy to further discuss or answer questions about any or all of them. I know that was a bit of a spectrum grab bag. Let's talk about mandatory, then let's incentivize, then let's talk about all the trouble you get into when you don't, when you don't make everybody get a vaccine. But I really think your takeaway point should be, while you can require it, it may not be your best option at the moment, and it may not even be practical, right? Because not everyone can get it right now. And that your most likely pain point or uncertainty points are going to arise in the context of employees who probably have legitimate underlying medical conditions and whose doctors or healthcare providers may have concerns about their ability to receive the vaccination. And those are going to throw you back into the same conversations we've had from the last year. Final note point I'll leave on, and then I'll open up the questions, is simply because you've been vaccinated. I'm glad Dr. Ray mentioned this. We still have the Virginia permanent standards for COVID reduction in the workplace. I've read them too many times. They're boring. But anyway, I've read them a lot. There's not some magical carve out that says I got both my shots. Now I can take off my mask, run around and party it up downtown in Blacksburg without a mask. I assume you can still party in downtown Blacksburg. I haven't seen it in a while. So you're still going to have these same workplace protocols. You're still going to be masked and social distancing in the workplace because you may not know which of your fellow coworkers are vaccinated. You probably don't know which of your customers are vaccinated. So I don't think that's going away for a while, and it's not going away absent changing in the law or direction from the Department of Labor and Industry. So that's probably going to continue. I think the last thing I'll leave you with too, the other question I get is, excuse me, can I, as the employer, ask my employee whether they've been vaccinated or require them to provide proof of vaccination? And the answer to both those questions is yes, with a few warnings. You can ask somebody, have you been vaccinated? It's not a medical inquiry under the Americans with Disabilities Act. It's not a discriminatory question. The employer can say yes or no. Where you get in trouble is where you go that next step and say, why not? Because then they may say, well, because I have this underlying disability condition, or because my religion prevents it, or because I didn't want to. And that's where you don't want to go, but you can ask. And if someone says yes and say, great, can you provide confirmation, or you say you've been vaccinated, will you provide confirmation you've been vaccinated? That's a perfectly fine request. The concern there, the danger there is you really just want that proof of vaccination, maybe from a pharmacist or from a medical provider. You might want them to redact, or might want to mention, hey, we just want proof of your name, the dates essentially that it was performed. We don't want any other diagnostic notes or medical information, because I've seen people respond to this by giving basically a copy of their primary physician's healthcare file to us, and just been like, we didn't want all that medical information, and now we have knowledge of it, an obligation, and that creates potential exposure for an employer, because now you know more about someone's medical history than you needed to know to answer the question. So I'll leave with that. I'm gonna look at my comments here real quick.
I do have a question, Eric.
Sure.
So I think you did a really good job of kind of going over what it means for any of us who have employees, but of course, many nonprofits have volunteers that are delivering their services. And so how different, or can you require volunteers to get a vaccine? What that seems to me to be a rather gray area. So can you talk a little bit about that?
Absolutely. And I'm really glad you asked that. That's a bullet. You can't see my screen, but that's a bullet here on my screen. And somehow or another, I just went straight over the rainbow on it. Let's do a spectrum of control for an employer. That's how I want to do this. I don't know if my screen's mirroring or not, so I have no clue whether I'm supposed to start with this hand or that hand. So if I go the wrong hand, pretend this is in Arabic. Let's talk about who an employer has control over. You probably have the most control, arguably, over your volunteers more than your employees. And here's why. I mean, that's a toss-up. We've talked about the control and the questions you can ask for employees versus volunteers, but employees have certain rights by being employees in the workforce. Volunteers, on the other hand, are essential to many nonprofits, but they're offering to volunteer their time and efforts to support a mission. Well, the organization gets to set the mission and the parameters. Now, am I saying you should require every organization out there to require every volunteer to fill out a lengthy medical questionnaire or exam? No, but if you have a legitimate reason to be concerned, like for example, what if your organization is delivering meals to elderly or disabled shut-ins throughout the New River Valley, and they're going to be helping maybe in some cases feed them or prepare that food. It's going to be very close one-on-one. You got to make an assessment. Is there a threat there? Yeah. Is there potential risk there? I don't know that there's liability necessarily, but I would certainly have a little bit of heartburn and be saying, well, is it reasonable in that situation for us to ask volunteers to be vaccinated if they were eligible to have been vaccinated, or, to confirm that they're not, if we had the rapid test available to confirm they're not COVID positive? I think it's reasonable. I don't know if it's required at this moment. I think you might get there at some point, but at this moment, I think it's perfectly reasonable to request that or to set those parameters. We likely, at least some of the larger nonprofits I've advised with regard to this and across the state, actually, uh, we're already using similar protocols under those permanent standards. You know, we're asking our volunteers in the last 48 hours, have you been exposed to anyone who's known to be infected or suspected to be infected, or do you live with them? You know the protocol and the run through. And if so, we can't let you volunteer. Are you experiencing any COVID symptoms? That sort of deal. And we're already using those metrics. So I don't think that throwing the vaccine in the mix as a requirement is necessarily an issue. I do think, you know, you might lose some volunteers. And again, that's kind of the encouragement versus requirement mandate. I think it will be in the future, I at least hope it will be a much less, excuse me, controversial statement to say we're requiring all volunteers to have a vaccine, just like we require our employees to have this vaccine. But right now, I don't know that our community's there yet, which is sad for me. I get to talk a little bit about my own personal beliefs here occasionally, but at the same time, I'm sympathetic to concern about the medical effects of a new vaccine. I'll leave it at that. But I do think you can control volunteers. The next question that I have is, what's the last kind of metric on that spectrum of control? And that's the one that kind of stops me. That's what your customers, that's your service recipients, that's your patients. That is a hard one. If there isn't a kind of opt-in or a contract or some sort of criteria for use or receipt of the nonprofit service or the business service, it's very hard to do things other than bar people from services, which I'm not sure we want to do in many of these cases, for failure to abide by criteria. I do think in some situations we're going to have to put in protocols in place, which we've already done some places, such as, hey, we're coming into your house today, or we're bringing food. I need you to walk through this questionnaire with me. Are you experiencing symptoms? Have you been exposed, etc.? And if they say, I'm not answering any of that, pound sand. I'm sorry, we're not going to be able to come in today. We're going to leave this on the porch. We're not going to be able to visit you. I think those are perfectly legitimate responses. I find them disheartening, but I think they're legitimate. Does that kind of address your question?
Yeah, absolutely. That was really helpful.
Problem. If you're going to volunteer, I'm not forcing you to do something, but I'm going to say, hey, you got to wear a green T-shirt so we can identify you. You got to show up sober. I think that's usual requirement for things.
Mm-hmm.
You have to have CPR training. Those are the sort of parameters you can put in place on volunteers that are reasonable in the circumstances.
Eric, I have a follow-up question to that. I'm sure that the university lawyers are hard at work on this and thinking about what they can require in terms of students and whatnot. But for VT Engage to have volunteers, going, to work with vulnerable populations, et cetera, what are your thoughts on us requiring, the students to have been vaccinated? And again, I'm sure university lawyers are on this, so you don't need to be the end all be all.
I mean, I'll take a shot from the hip. It sounds like fun. Catherine, you're always so much, you told me I have no good jokes, and then you asked me to opine on public government law. I think my question hits that. So I'm not sure if Virginia has changed yet its student requirements, but there is a question, on what vaccinations one must require to be admitted as a student. I know that Virginia hasn't done it for COVID yet. I think that's a future question. At the moment, I think if VT Engage is volunteer based, if the students are volunteering, I think you can set some of those same parameters, but I would be cautious. I'd consult university counsel because you are a quasi-governmental entity, and I think that could run you into some friction. Now, the current Virginia government seems fairly, favorable towards vaccines, so I doubt they would have a big concern with it, but there are some concerns in that context about, is this the government making me get a vaccine? And I don't think it gets there if they're doing volunteer work. I think, again, it's that reasonableness requirement. What's the threat? Is what you're doing, is it reasonable for us to ask these things of you, ask you to wear a mask, ask you to complete the protocol. All those are absolutely reasonable. Vaccine, I think a strong encouragement program is great if they're eligible to receive it. But I suspect, as you said, you'll have answers to that by the time it becomes a working concern, because again, right now, not everybody can get it. I don't think most college students could qualify for it. I guess maybe if VT Engage would consider frontline essential workers, they'd be eligible right now. One footnote, I think to Dr. Ray, hopefully I'm not incorrect, but right now 1B is only frontline essential workers. There are other essential workers, but I think we're prioritizing frontline and customer facing individuals. Does that kind of answer? I know I dodged the Catherine, but I
No,
tried.
that's great. Thanks, Eric. I appreciate it.
Anybody else? Oh, so I got one here. We had a question about COVID shot, and he's out sick today. Does he use his leave, or do we provide an extra day off? You know, PTO is one of those interesting things in the world that no one thinks about. It's not federally mandated. Paid time off is what PTO stands for. Not federally mandated by any law. There are state laws that require employers to give PTO in certain instances. Virginia is not one of them, so PTO is literally not mandated. So whether it's his paid time off, or it's the employer saying, I'm sorry you had an adverse reaction, that sucks. We're going to pay you for that day, you know, just because we think that was the right thing to do. It's still money that the employer is kind of offering gratuitously to the employee. If it were me, I'd probably pay someone. There's a correlation between why they're sick and they, you know, they've voluntarily made themselves sick in order to make themselves safer. But it doesn't hurt the culture and the morale and the goodwill. Of course, if you only have 2 people in your office, like you say in the messaging thing, the morale and the goodwill seems like it's probably fairly easy to fix or to maintain the equilibrium. Either this person likes this person or they don't, and then you have a morale issue. But I mean, yeah, that's your call. I mean, there's no law that's going to make you do one or the other, but it's whoever's in charge's call. So.
Okay, thank you.
Anybody? I didn't miss any questions, did I? Well, I thank y'all for your time. I'll turn it back over to Ashley. I think she's gonna play us out. They wouldn't let me play the drums to play us out, so. Thank you all.
You answered all the questions. Thank you, Eric, and thank you, Pam, for that. There was some good discussion in the chat box this morning. So thank you guys for being active and engaged on an icy day. I just have, I'm going to share my screen real quick here. Just a few quick announcements, and then I will let you guys go. Okay. So this call was recorded and we will post it on our website as we do all of our calls. So if you guys wanted to rewatch this or if you wanted to share it with anybody, it will be available. Our next call is going to be March 18th and it's going to be a self-care panel. So stay tuned for some additional details there. If you have not registered for Give Local NRV, please do so. We have our first webinar coming up next week on February 23rd. It will be at 2 o'clock. And so if you can't make that, it will of course be recorded and put on our website as well. But we would love for you to make it if you can. Thank you so much to everyone who took our COVID-19 check-in round 2. That's really helped us determine a lot of what our listening sessions are going to be moving forward. It's still live, so if you haven't had the opportunity to take that yet, feel free to do so. And we really do appreciate you guys being on this morning and joining us and bearing with us as we had a little bit of shift in our planned agenda. So with that, I will let you all get back to your Thursday and we will see you soon. Thank you.
Thank you all.
Bye all. Stay safe.
You too. Bye.